before we jump into it, I just want to know, how are you doing? Like, all the love and support that you've been getting since match day.
Mhm.
How are you taking it all in? How's it going? How are you feeling?
I would have to say just day by day. I'm kind of like, I wouldn't say over it because I'm like back in class. So it's
Yeah.
like, I'm more just focused on making sure I get to the graduation line.
Yeah. Wow. Wow. So you are the first Black woman to be accepted into Vanderbilt's medical residency program. And you specifically, your focus is neurosurgery. Is that right?
Yeah, so I'm the first Black woman to train in their neurosurgery residency program. Yes.
Wow. Wow. And so was Vanderbilt your first choice?
Yes, it was. I love
It was.
Vanderbilt. Yes.
Okay, and when you got the news on match day, were you aware of the you making history part of it, or was that short after, or did you know?
Um, I kind of knew, but not really. Like I had a feeling because I had never seen like when neurosurgery is a really small field, especially when it comes to the women. So you
Yeah.
kind of get an idea of who trained where,
Mhm.
and no one ever talked about Black women training at Vanderbilt. So I felt like maybe there had, but you never know because
Yeah.
neurosurgery's been around for like 100 years, so it's like you don't know if someone did or didn't, if they lost record or something. So
Right.
I didn't really know, but I felt like there weren't that many Black people who trained at Vanderbilt.
Yeah. Yeah. And then when you found out that you're the first one, how did that feel? How did that make you feel?
It's just crazy because it's like you read about this stuff, you don't think that it's going to happen to you. You're like, oh, this person made history, or like you learn about what people do, and you're just like, wow, I wonder how they did that. And then it's like,
Yeah.
oh, wait, I just did that. So
Yep. You
it was pretty
did.
cool.
You did just do that. So give our readers, give our audience kind of your background journey. So where you're from, where you did undergrad, what made you want to go into neurosurgery, kind of put it all in a neat little package for us.
Yeah, so I grew up in Tallahassee, Florida, Wakulla County, Florida. My mom is a nurse and my dad's in the military. So that's kind of where the medical background came from. So I was just always interested in just anatomy, physiology. I went to a high school, Wakulla County High School, where they really wanted to make sure you had a job after you graduated. So I got my certified nursing assistant license when I was 17. And that's whenever I started working with patients. And so this was right before I went to FAMU in the fall. So I did it all summer long,
Mhm.
and I was working with patients, but I didn't have the medical background. So,
Mhm.
okay, if you're in a nursing home, people have Alzheimer's, they have dementia, they have spinal deformity. And I didn't understand that. I just was like, it's very hard for me to do my job, and I don't understand why. Like if I come in every single night, I have to reintroduce myself. I have to, make sure you're comfortable working with me. And it wasn't making sense because I work 5 nights in a row. So I'm
Wow.
like, how do you not know that it's me? It's me
Yeah.
again. Didn't know about dementia, things like that. And so
Mhm.
when I got to FAMU, I went to Florida A&M. I'm a third generation Rattler. My grandparents went, my parents went, everybody went.
Yeah.
So I was, and I majored in chemistry, pre-med, and that's whenever I started taking anatomy, physiology, and things like that. And
Mhm.
that's whenever I started to understand, like, oh, that's what was going on. That's why they were having those issues. And, when I was working at the hospital in Tallahassee, I was a float CNA. So wherever they needed help, that's where they put me.
Mhm.
So I was exposed to everything. And it really wasn't until I was working in the neuro ICU that I was like, okay, this is the patient population I want to work with, because it wasn't just me coming in, bathing patients, feeding patients. It was me trying to figure out why these patients were having the issues that they were having.
Yeah.
And from there, I was like, okay, I want to be a neurosurgeon. Where do I need to go to be a neurosurgery? Like, where should I go to med school to make that happen? And so everybody thought I was just going to stay in Florida because, again, everything's in Florida. But I had some advice from a mentor who told me to go to Case, and I had never heard of Case. I thought it was a military school because it says like Case Western Reserve. And I was like, ew. That sounds like my dad's military. I had enough of that. I don't want to do that. But nah, I was like, okay. So I applied to Case. I got into Case. And so I did my time here. And, now I started Vanderbilt July 1st. So it's been a journey.
July 1st. Oh my goodness. Now you
Yes.
mentioned mentors. Who
Mhm.
are, do you still have some of those mentors that maybe started off with you at the very beginning who are still, mentoring you to this day, or who are some of your mentors that you want to give a shout out to?
Absolutely. I'd have to first start off saying my OBGYN, Dr. Brickler. Him and his family are a patriarch of OBGYNs in Tallahassee and have really made a name for themselves. And he bought me my first stethoscope. He wrote my letter of recommendation for me to get into medical school. I shadowed him for 4 years straight, and that's how I knew I did not want to do OBGYN.
Yeah.
But he was there for me every step of the way. He helped me get into med school. So, I have to pay it to him and Dr. Tanjanika Wilder. She was my anatomy professor at Florida A&M University, and she always pushed me to keep going. And then, when I got to Cleveland, seeing my first African American female neurosurgeon, so Dr. Tiffany Hodges, Dr. Debbie Blades, they were the ones who helped me see that what I was, aspiring to was actually possible. It wasn't something that I was just like, okay, I'm going to do this. I don't know how, but it had actually been done before. And then, Dr. Crystal Tomei, Dr. Varun Kashetri, and Pablo Racinos, they really opened the door to what neurosurgery could offer to me, because I didn't realize that, neurosurgery has so many subspecialties and so many different things that you can do in neurosurgery. And I didn't know any of that until I met them.
Wow. Wow, that is wonderful. Just hearing you describe that made me reflect back to my law school days, and the mentors, and me first seeing, some of the first Black women that I knew, because we had no we had no attorneys in my family, so I was the first
Mhm.
one. And so seeing it like you just described really does make a difference. It really does let you know that this is not just a pipe dream. I can achieve this. I
Right. Yeah.
Yeah, so representation, seeing
Yes.
us is very
Mhm.
important. Um, and so in terms of your focus, have you decided like what your focus is going to be? I know you mentioned
Spine.
something about, yeah,
I'm a
dementia.
spine girl. Yeah, I like
Okay,
the
fine.
spine. I
All
really
right.
like the spine. Yes.
Okay. Do you have any desire to do any work in the dementia area, dementia, or just those types of areas?
That's not really a neurosurgical thing. That's more of
Okay.
a neurology thing.
Oh, I see. See.
Yeah, I'm more on the surgical aspects of, what surgical things can I fix?
Got it.
Dementia can be a complication of a neurosurgical problem, but that
Yeah.
wouldn't be something that neurosurgeons kind of fix.
Thank you for clearing that up, because
Yeah.
I wasn't quite sure when I was coming up with that question. I was like, I'm not
Mhm.
sure if this is applicable to her, but I'm going to ask her anyway. Because if anybody can clear it up, it's her.
Yes.
So going to Vanderbilt, knowing the history that you're making going into this environment, and also I know you're not in the political arena, but just some of the local recent headlines that's been happening down at the state house with the expulsion of two of its African American members. Do you have any reservations or concerns going into the environment as the only Black female accepted to the neuro surgery program, or are you the only one? I know you're the first, but will you be the only one in the program?
Yeah, I'll be the only Black female. There is another Black male, but no, I grew up in the South, so this is nothing is really new to me. For me, I'm just going back home. So
Yeah.
I'm just excited to be back in that environment. I mean, it comes with what it comes with, So, it's not like I haven't seen anything before. I mean, the new challenges will just be me, acting in the capacity as training to become a neurosurgeon, but it's not necessarily, the way of life, the culture. I'm just going back to what I know. So,
Yeah, I understand that too. I'm originally from Georgia. I went up to
yeah.
Michigan for law school, left Michigan, moved out to Washington, D.C. So
Mhm.
I know exactly what you mean.
Yes.
I know you'll be fine. You'll do great. You're gonna rock it out. We are so proud of you. I don't even know you, but I'm so proud of you. I'm
Thank
thrilled to
you.
meet you today, but I'm so proud of you. But speaking along those same lines, what are your thoughts on how few of us are in your field, in the industry? I read somewhere that there were only 33 Black female neurosurgeons.
Mhm.
What are your thoughts around that, and how do we improve that? How do we increase that number?
So I see it in two different ways, right? So I see it from the institution side, and then I see it from the applicant side. And so if you look from the applicant side, I think people sometimes just have to realize that not that many people want to be a neurosurgeon, and not that many Black women want to be a neurosurgeon to begin with. So, you know, a lot of people see the number and they're like, oh, we have to do something about it. And I do think we do, but I also think at the same time, you have to remember that that's not everyone's dream. So if you don't have that many people wanting to do it in the first place, then you're not going to have that many people finishing it. So that's on that side of it. But I think on the institution side, I would just also have to say exposure. You know, I think whenever you look at jobs or whenever you think about some of the things that are possible for you, a lot of neurosurgeon is not the first thing that comes to anyone's mind. And that's whether you're black, white, whatever color you are. Most people are not, they don't just wake up in the morning and they're like, you know what, I'm going to be a neurosurgeon today.
No.
You know, it's something that, you know, it kind of grows on a person, or they have experiences that kind of point them in that direction. And so I think for, you know, African American people, the problem is there's not that much exposure in the first place. You know, there weren't doctors in my family, so I didn't know. Like I just told myself that's what I was going to do. But if you have someone who is not in an environment where they have the resources to do these things, or they have the understanding that it's possible, then you'll end up in a situation where you have low numbers of people, you know, specifically African American people, trying to do these jobs because they don't even know how to navigate, you know, the workplace. Then when you look at the structure of how medicine and medical education is set up, it's set up for people who've done it before. It's set up for people who have, you know, parents who were doctors and grandparents who were doctors. They come from a long line of family of doctors. Not saying that if you don't have that, you can't get through the system, but it'll just be a little bit harder because you may not have the support from the people around you because they don't even know what you're supposed to be doing. And I think that was hard for me because, you know, people think that medical school is like college where you get grades and you have a GPA, and it's like, it doesn't work that way. Like when I say I'm in school, school means I rotate at the hospital, and it means that I'm working, you know, from 6 a.m. to 6 p.m., but no, I'm also not getting paid. Like I can't, you know, like a lot of people don't understand that type of curriculum and that type of training. And so sometimes it's hard to get that support. And when you don't have that support, it is harder to get to the finish line. And so I think, you know, when you look at the entire thing from both perspectives, I think one, we as a people have to have more exposure to these types of fields to say, yes, this is possible. Like you shouldn't go up to every Black girl and say, you can be a nurse. Okay, you can also be a doctor. You can also be, you know, a lawyer. You can also be a physicist. You can also, and they're all attainable. Right. You know, they're not things that like, oh, I can never do. Oh, yes, you can. There's nothing wrong with that. You know, we shouldn't just stop, you know, at getting a bachelor's degree. Go get your graduate. Go get your doctorate. Go, like, keep going. There's nothing wrong with going past that. And so I think we should do better, you know, increasing that exposure. But I think at the same time, we also have to think about the fact that there's only 5,000 neurosurgeons in the United States. That number is small for a reason. You know, this is not a job that everybody wants to do. So I think we have to look at it from both sides.